Hello everyone. Good afternoon again to everyone. This is Dr. Bharti from VJN RadarOpus software team. So now we are going to start the webinar on the case discussion on cholesteatoma and epilepsy with Dr. Prashanth. So here I am giving brief introduction of Dr. Prashanth. So he is a consultant homeopathic physician practicing for more than 18 years in Bangalore. He has done BHMS from 𝐅𝐫𝐞𝐞 Bangalore and his postgraduate degree from NESH, that is New England School of Homeopathy Amherst, USA, SCPH and SCPH Plus from Predictive Homeopathy, Mumbai. He is a direct student of Dr. Paul Herscu from 2 years course. He is a specialist in emergency and chronic cases. So this was a brief introduction of Dr. Prashanth. Now I hand over to you, doctor. You can start the webinar.
Okay. So this is going to be a pretty short webinar. What I have in mind is 3 very good cases and another case which I will speak about orally. So these are the cases I have are advanced pathological cases. So I want to show my community the way I handle these kind of advanced cases and how we go about doing it in a relatively straightforward and simple manner without complicating either the life of the doctor or the life of the patient. So, okay. So basically, my first case today is a case of cholesteatoma. What is a cholesteatoma? So what it is a skin line cyst that grows abnormally in the middle ear behind the eardrum. Now, it can be congenital, which means it is either present at birth, or many cases it actually arises because of chronic ear infections or eustachian tube dysfunction. Even though it is not cancerous, it is a very, very severe illness because this cholesteatoma can actually completely take over or damage the middle ear, including the tiny bones of hearing, and it can go and extend to inner ear and cause damage to the brain as well. So generally, it is considered a very, very serious medical emergency. So the first case is of a 45-year-old man who got operated on his left ear about 3 years ago for cholesteatoma, and he came to see me on 19/5/2025. He had a history of discharge from the ears from early childhood. So this is where we actually get to know that there was some problem with regard to his eustachian tube and how it would drain any fluid. It was basically not functioning at its optimum level. And so the cholesteatoma must have originated from there. So 3 years ago, he had an incident of bloody discharge from the ear. He was investigated for the same and was advised to undergo immediate surgery. Now, there has been a recurrence of cholesteatoma now again after these 2.5, 3 years, and he's presenting with bloody discharge and pain in the ear. Now, in a very simplistic manner, the case mentals, generals, and particulars are as follows. He is a very fearful person. He's nervous, anxious of the future, and a very controlling personality. A type, you can call this patient an arsenic type. That doesn't mean that he requires an arsenic album immediately, just that this is his type. Now he's a very hot patient with less thirst. See now, basically these are going against arsenic album. He overthinks a lot. He has had headaches ever since the surgery was done to his right ear. Then he said that he gets vertigo when moving the head sideways, and he has pain in the right ear. So basically, what was the symptomatic totality that was taken? It was taken that he was a nervous personality. He was quite loquacious. He had an ear hemorrhage, which was purulent. He had vertigo and pain. So I have taken all these in RadarOpus, and you can see the beauty of the software. I took ear hemorrhage, discharges purulent, bloody, ear swelling, head pain, nervous. I take nervous because any problem which with regard to head pain and ear pain, especially going radiating to the inner ear, is because of nervous phenomena. So I took one rubric called head pain, nervous. Okay. Then again, I have taken another wonderful rubric. It says vertigo, nervous affections with. So exactly what he had. And when I repertorize these in RadarOpus, I come to many remedies. And among the remedies that I come basically is a remedy called phosphorus. And I have a remedy called zincum phosphoricum. Arsenic, as you see, it also comes in the 8th position. I gave to the patient, considering the potential differential field, that he was a nervous personality and he had a certain kind of hypochondriac kind of a situation, anxious personality, and it also because there was an involvement of the inner head or inner ear or the brain. Therefore, I gave him zincum phosphoricum. Now, what happened on follow-up on 35/20/25 was that the ear pain had reduced significantly. The discharge from the right ear was only present while he was sleeping now. Earlier, it used to be present all the time. Now he says that the vertigo is there only on pressing a small circumscribed location on the right ear. Vertigo on moving the head sideways to the right. And he said that the knee pain has increased. So there is a concomitant you are seeing here, which will be evident towards the later part of the case. There was a pain. He says that there is a knee pain. Okay. That is a concomitant to the ear problem that he is having, which makes its appearance after the first prescription of zincum phosphoricum. Okay. Earlier also he had the knee pain, but it was not like it had not increased or he had had knee pain for a number of years. But after zincum phosphoricum, you see that the knee pain has increased. Now, follow up on 15/6/2025. I didn't deal with that until I got some new symptoms. He came to me with extreme uncontrollable ear pain, discharge from the right ear, which was aggravated sleeping, which was very offensive. Now the pain had spread from the right to the left side of the face. He said that the pain in the ear was ameliorated by pressure of hand. He said pain as if it's very sharp, it is extending to the inner ear. And he said there is double vision on waking up in the morning. Now, whenever you see double vision, you can actually say that there is some involvement of the inner ear and the brain and the cerebellum, etc. happening. So anyway, I took these main rubrics: pain, pressure, hand off ameliorates, pain, cutting pain, extending inward. So when I take these prominent rubrics and I look at the uncontrollable pain, I am led to a remedy called hyoscyamus from the Solanaceae family. So now I gave him 2 doses of hyoscyamus to be taken. You know, the first dose he required on that same day, after which his pain reduced. So I did not repeat it. After maybe another week or so, when the pain made its appearance, I asked him to take another dose of hyoscyamus 1 mg. So he reported back to me on 36/20/25. He said that the pain had reduced significantly. The discharge from the right ear, which was aggravated sleeping, which was very, very offensive, that remains the same. Now he said that the pain which had begun to spread on the left side of the face had now relocalized to the right side of the face. Now, the double vision on waking up in the morning had not been affected, and that remains the same. So now we have to search for a chronic remedy which covers the necrotic process inside the ear. So if you look at cholesteatoma, what it is it's a necrotic process. It's a process wherein the inner ear, there is some kind of extra growth which in which all the skin layers are involved, and they become necrosed. And they become necrosed along with the all the bones and all the other apparatus of the middle ear. So when I looked at this, I asked him a few questions about, capsicum. There is one very important keynote, that it is a very homesick remedy. So I confirmed I put first the pathological process that is happening. I needed one mental symptom to confirm whether he really needed capsicum. I put the mental symptom, basically ailments from homesickness. Why homesickness? I asked him, generally, are you very worried about your family and very worried about your wife, child? And are you comfortable staying away from house when you have to go out on a office visit or so? He said, no, I'm often reminded of my home and I'm very comfortable at my home, and whenever I'm outside I feel like going back to home. So this, and capsicum has one more symptom which I have not put in the repertorization. It is nostalgia, wherein a person who requires this remedy periodically reminisces about his childhood and all the nice and happy time that he spent during his childhood and during his earlier days. So that was also present in this person, and so there was no doubt that he required capsicum. So now I gave him capsicum annum 200 C twice daily for 7 days. So now the follow-up is basically was pretty recent. I took a recent follow-up because it has been a week. These are all pretty recent cases. He said pain is almost insignificant now. The discharge from the right ear is very minimal. He has no headache or pain in the ears. There is no double vision and there is no pain. So now this is an ongoing case, and we have come away from the situation wherein he had an emergency, or almost, as the visiting doctor had told him that if you do not operate it immediately, it will spread to the inner ear. So it's an immediate case for surgery. So a case which required immediate surgery, we have been able to take it away from that. And now he's quite comfortable. He would require other remedies in future. Mainly, if you look at the repertorization, aurum and calcarea flor are coming. These are two wonderful remedies which will be required because they have these, the same kind of necrotic process in the middle ear. They have the pain in the knees. Aurum is a very prominent remedy for pain in the knees. Calcarea flor also. So if the knee pain and if the ear necrotic process doesn't halt completely, we have these other remedies to which we can fall back on. So calcarea flor is a hot remedy like capsicum. So it's a cognate of capsicum. Aurum metallicum is an anti-syphilitic remedy. So these are remedies which could be used in future. So what did we learn from this case? We learned that this illustrates the management of a very severe homeopathy. The goal of the treatment currently is to restore the ear to a condition where all the necrotic tissue is removed or discharged and to preserve the remaining healthy tissue. The goal also is to reverse any healthy tissue which is becoming necrosed from becoming non-necrotic, to make it into healthy tissue if it is possible. The third goal is to prevent recurrence of the situation. Identification of the chronic remedy capsicum in this case is very important, as that shows us the way forward. Another cognate remedy is calcarea flor and aurum metallicum, considering his severe knee pains, which is a very important concomitant which will be useful in future. Again, the first remedy that we gave, zincum phosphoricum, will also be useful in future to prevent any nervous deterioration of hearing in future, which basically means to prevent complete sensory neural deafness. Now we come to the second case. This is a case of epilepsy. Okay. Now, case of epilepsy, this is a 24-year-old lady. She visited me about, she came on, I think, 15/5. I think in the beginning of June, she came and visited me. Okay. And so she says that she has seizures and the body freezes up with eyes fixed at one point. She has very severe seizures which happen about twice a month, and she's on anti-epileptic medicine. So in spite of it being on anti-epileptic medicine, she has very, very severe seizures. The lower jaw moves to the right and vibrates. Now this she did not describe, this her parents described because they have witnessed this happening. Now, what is the chronology on how this started? This started from June 2024. Before this, she has had a history of vertigo with the head spinning since the age of 50. Now, why she might have had the vertigo, I took the case history, so this may or may not be related. So the history there was a history of fall when she was 15. While cycling to school, a car's door on the road opened and she had an ankle sprain for a few days. These vertigo head spins used to come either when she was stressed out or around the time of menses. I took the case mentals, generals, and particulars. I only take the most important mentals, generals, and particulars while prescribing on a case. The case taking would be quite a long case taking, but I have right now, when I either repertorize or when I look at the case, the symptoms to be repertorized, there would be a very, very small subset, not more than 5 symptoms, 4 or 5 symptoms. So the case was what the main key symptoms of the case: very fearful person, worried and anxious, has a lot of anxiety. She is confused while talking and communicating. She has vertigo during menses. Vertigo worries a lot about everything, especially anticipatory anxiety before meeting somebody. So first prescription, we took this symptomatic totality: fear and anxiety, confusion of mind, vertigo with convulsions, vertigo during menses to the point of unconsciousness, vertigo as if drunk. So when I put all this into the RadarOpus software, you see mind, confusion of mind, vertigo with mind, anxiety, fear, mind, anxiety, anxiety consigns of, mind, unconsciousness, menses during, generals, convulsions, epileptic during menses, vertigo intoxicated, vertigo menses during or before, and vertigo reeling as if drunk. Vertigo as if drunk, the way when you translate into repertorial language, vertigo reeling. The remedy that comes up is Cocculus indicus. Okay, you see Nux vomica, phosphorus, pulsatile also come up. The most indicated remedy when we take the very key symptoms of the case is Cocculus. And of course, once you get Cocculus in repertorization, it's a much more severe remedy than phosphorus and Nux vomica. And it's a remedy which is a primary remedy for vertigo, for all the people who have thought a lot and who do a lot of overthinking and who have a lot of anxiety. You can think of Cocculus as, in terms of gear, if phosphorus is the first gear of a vehicle, Cocculus is the third or fourth gear of the same vehicle in the same situation. So what happened after Cocculus indicus? There was a process. I put Cocculus indica 1M immediately, basically in my clinic. And after she took Cocculus, she said that the whole body vibrated. And she did not settle down for 30 to 40 minutes. So we simply waited. She experienced transient pains at various points in the head, followed by a headache, which settled down only after about 30 to 45 minutes. After that, she felt much, much better. I don't usually, every once in a while, when I notice this deep healing reaction, and I consider the age also, I said, okay, she has had a deep healing reaction. You do not give the anti-epileptic medicine if she doesn't get any epileptic attacks or anything like that. So we'll stop the anti-epileptic medicine. So over the next 10 days, whenever she got some vertigo or a situation wherein it would go into some kind of an epileptic attack, this Cocculus indica 1M was repeated 2 more times. And I had given her Cocculus indica 6C just also to cover the pathology. I have not mentioned here, but she has also taken Cocculus indica 6C later on after the 10 days for about 3 days. And finally, when Cocculus indica did not hold, I asked her to come again. So 5/6/2025, she presented with new symptoms, but by the time the symptom totality had shifted. She was feeling very scared at night. She wanted to have the lights on and had difficulty in going to sleep. She was feeling scared of very, very small things. She said confusion had a little bit increased and she was in a dreamy kind of state. When I looked at the above totality, based on the above totality, I prescribed phosphorus 1M BD for 5 days because feeling very scared at night, wanting to have the lights on, difficulty in going to sleep, that feeling scared, all these are more prominent in phosphorus than in cocculus. So the dreamy kind of state is also more prominent in phosphorus than in cocculus. So she had shifted. I gave her phosphorus 1M BD 5 days, which is bis daily 5 days. On 11/6/2025, mother reported that she's feeling much better after the remedy. She got some rashes on her hand after the administration of the remedy. She's sleeping better now. She still has her fears, but the fears are at a much, much reduced level now. Mentally, she's much, much better. Now she has developed some physical symptoms of phosphorus, which include acidity and increased appetite during the night. These are again keynote symptoms of phosphorus. And she got some physical symptoms like rashes on the hand. So I stepped down in potency to phosphorus 200C, given once a week. And the patient is doing fantastic. We have not had any reason to give her any more or any new medicine till now. Okay. So what does this case illustrate? The case illustrates the management of a very severe situation of epilepsy using homeopathy. The goal of the treatment currently is to restore the brain and also address her psychological issues. Identification of the state remedy cocculus in this case is very important, as that shows us the way forward. The follow-up remedy phosphorus removed the symptoms of the state that were presented, which succeeded cocculus. We will have to wait for any states that may present in future which are different from phosphorus and administer the relevant remedy when the need arises. It is not that as we simply give new remedy. We have to wait until a new state or a new remedy clearly presents itself. Now, in our clinic, the goal of the homeopathic treatment, we feel it should not just be the removal of any pathology present, but it should also be the development of a healthy personality. In this case, the fearful and anxious personality must change towards something which is less fearful, less anxious, and which is more confident. So now, the last case for today, and after that we'll open up for questions. Once the question and answer session is over, I will introduce another very short case, which is a very interesting case, but I have not prepared anything because it is not a repertorial case. It is something that a materia medica case. So I will present that after I take your Q&A. So this is a case, a veterinary case of diarrhea, vomiting, and indigestion. So this is a case of a 6-year-old dog, Shih Tzu dog, with vomiting, loss of appetite, and diarrhea. It was first seen on May 15, 2025. This started about 2 to 3 years ago after the dog was vaccinated. So what are this vaccination is the chronology, is the causation. But the thing is that the very unique thing about this symptomatology is that all these symptoms would only come in cold weather and cold wet weather. The dog would become dull and sluggish in cold and cold wet weather. At that time, the dogs, they try to set themselves right by fasting, and it would become all right after fasting. But whenever after fasting it would eat some food, it would suffer from food digestion issues. It would have vomiting and uncontrolled diarrhea. And then it would just lie down at one place without doing anything. So first prescription on May 15, 2025. What was the symptomatic totality? The first thing that I had to do was bring this dog to a state of health. I can give other remedies, but first, key symptoms of the case: desires change. It likes to come to different places in their car. It had a certain lack of self-confidence. You have to learn how to understand a dog's, mind. Even dogs have mind. From when I was looking at the symptoms in the case, I was told that the dog, whenever it would develop this vomiting, its mind would be proper, but it would start fasting, and it would try to set itself right by itself by fasting, and then it would go and again have food out on the 3rd or 4th day of fasting. But again, when it would have this diarrhea and vomiting, it would lose heart, and it would just lie down, barely eating anything. It had become very thin. Nutritional assimilation issues were there. You can say that because this was happening for 2 to 3 years, and this cycle, Chakravyuh, we call it in Sanskrit, would continuously repeat. She would go to the veterinary doctor, and the veterinary doctor would give the dog some injections. It would be all right for 2-3 months. Again, this problem was starting, or would continue, and the dog had become very, very weak. So when I looked at the case, I took all these things, and then when I looked at the case, my eyes fell on Sanicula. And Sanicula is very similar to Silesia and Calcarea and even Natramure. Sanicula is something which has Natramure, Silesia, Alumina, Calcarea, and without further ado, I prescribed Sanicula Aqua 30 ch bis daily for 7 days. Follow-up was on June 1st, 2025. The new symptomatic totality was that the diarrhea had stopped, okay, had reduced but not stopped. Sorry, the diarrhea had reduced but not stopped. He has started eating little. The dullness and the sluggishness, there was no change, but he has become somewhat more active. That extreme situation, from that he had become better. Now again, I took the case. The second prescription was on June 1st, 2025. Dullness and sluggishness, diarrhea which can become extreme, loss of appetite accompanied by indigestion, ailments from vaccination, aggravated in the cold and cold wet weather, which is a typical weather in Bangalore during the winter season, because cold and cold wet always come together in Bangalore these days. So second prescription, the symptomatic totality was this: dullness in cold weather, diarrhea which is aggravated cold and aggravated cold wet, appetite is poor with slow digestion, aggravated cold and cold wet in general, because the dullness as well as the appetite and the diarrhea are worse in cold. So I can make it into a general, going by Bonninghausen's generalization. Now based on that, when I took the totality, the only remedy that came was Merxol. Okay. Then after Merxol on 29/6/2025, diarrhea has reduced significantly. Appetite has improved only marginally. Mental dullness has improved and is more interactive. So now I took the remaining part of the story, which was mental dullness, which the appetite has not improved. So I have taken stomach appetite diminished. And they mentioned one more symptom, that कभी-कभी तो इसका appetite ठीक होता है, but it alternates. Sometimes he eats a lot, sometimes he doesn't eat nothing. He eats nothing. So appetite increased alternating with diminished appetite. That is another rubric I took. Then I took vaccination rubrics, and I took especially the fact that he had become dull, especially after that vaccination. I took that. But even if you don't take that, you see Thuja and Silesia. So Silesia, more than Silesia, based on the weakness in the dog and the dullness in the dog, I gave Thuja 200 c BD 3 days. Now the follow-up, which was recently taken, I called them up to find out how the dog is. I had gotten the very first thing, that after Thuja, the dog had a change in the nature of the stool. They said it became dark, tarry, and like as if blood is coming, and she had gotten worried and she had called me up. I said, just leave it alone and continue with Thuja. Then gradually over days, it had become green and then yellow. That's a typo. Then the dog's appetite and general mood now, when I had called them up yesterday for my presentation, it had become very good. And dog, she said it has no problem so far. And already it had become better with Merck. And now after Thuja, it has become even better. So that's the end of my presentation. So this is not a case which was repertorized. This was a case about a 47. Let me just take out my case. So this is a case of a 47-year-old lady. Okay. Now, basically, she came to me for extreme, menses. The menses which would last almost 30 to 45 days. She said she goes like, her last menses was, when she came on basically 8/8/2024, and the menses would not stop. She had already menstruated for almost 2 months. The bleeding would not stop. And so at that particular point of time, this is an old case, her menses had stopped by the use of 𝐁 10 in repeated doses, and the pains, she never had any episode of this prolonged bleeding after I had given her 𝐁 way back in August 2024. Now, recently, it so happened that she probably has come closer to menopause. That is number one. And there was a very stressful event in the family wherein there was her father-in-law had gotten admitted to hospital, and her mother-in-law was also sick, and there was a lot of tension and stress in the family. And she had become very, very duty conscious, like a Kali, you know, whether I'm doing my job well, what am I doing? And I knew that she was a Kali in terms of her general demeanor and overall keynotes, because she had been helped with causticum, she had been helped with colica for other symptoms that she presented. And there is one remedy which is very, very important to stop uterine bleeding in a case which is basically which has uncontrolled hemorrhage from the uterus, and in a case which resembles Kali, which is Kali ferrocyanatum. Now the trouble is that I had given her Kali ferrocyanatum in 200 potency, and we even were ramped up to 1 m potency in single and repeated doses, and the bleeding was just not stopping. This time the bleeding had gone on for 45 days, and I asked her to come, you know, please come to the clinic and we will see what to do, what best to do. I did not know what remedy I would give her, you know. And so basically the way I looked at the case was, she was a case of Kali, you know, she needed some remedy which was similar to Kali, but she was also a very sensitive, very, very sensitive lady. So I go in these cases, I refer to a concept called superclasses and subclasses that is developed by Dr. Rajan Shankaran and another lady called Michael Yakir. Now they classify remedies into 6 classes. So now the Kali, if you look at it, it is basically the remedy Kali. Kali comes in the 4th row of the periodic table. Okay, below Silesia and the below Silesia row, it comes in the 4th row of the periodic table. Similarly, in a concept called superclass, we see all these remedies, plant remedies, which also belong to the 4th column. There the row translates to a column. So it is basically just like that, but you know, every row of a periodic table, like the hydrogen row, the silica row, the calcium row, and the silver series or the silver row correspond to a similar row, or you can call it a column, in the plant periodic table. There is also a plant periodic table. So in the plant periodic table, I found a remedy called Thalapsy bursa pastoris. And the reason I picked up the 4th column itself, or the 4th row, is because the characteristics of the people needing remedies will be similar. So even if you take the 4th column or the row in the animal kingdom, they will have similar characteristics. But because she was a very sensitive woman, I picked up this 4th column and investigated remedies which had uncontrolled hemorrhage. I came to this remedy called Thalapsy bursa pastoris. And because not many of you will be familiar with the concept of columns and the concept of superclasses, you know, what I can tell you is that I am going to give you the keynotes of Thalapsy bursa pastoris. And when all these keynotes are present, that is when you actually prescribe Thalapsy bursa pastoris with great success, as I did in her case. So the first keynote is uncontrolled hemorrhage and bleeding, wherein the materia medica writes that scarcely has the person got any time to recover from one period that it flows into the other. The second keynote, important keynote of Thalapsy bursa pastoris is during childbirth or during menses, there is very, very painful cramps. It is not painless bleeding, it is very painful bleeding. That's the second one. The third keynote of Thalapsy bursa pastoris is, and it's a very important keynote, it is the keynote of history of abortions, multiple abortions, or at least one abortion. This lady for whom I was investigating the case had history of multiple abortions during pregnancy. Fourth, history of hemorrhage during pregnancy. This was also present. And lastly, the people who need Thalassi bursa pastoris is a very, very similar to Kali Karp and the Kali line. You know, they are very, very similar, very, very duty conscious. They will be, you know, like, oh, I did not do this, I should have done this better. They forget about themselves and they start worrying about others, maybe somebody else in the family, some relative, etc. So I gave you the 4 or 5 very, very important keynote, and these are all arterial bleeding, meaning that this is not venous bleeding, it's active hemorrhage. And finally, the last keynote will be at the very end stage when they are bleeding, they will have vertigo spells. They will feel like falling. So when you have all these keynotes present, multiple keynotes present, then you know that you can prescribe the Thalassi bursa pastoris with confidence. In my case, I prescribed her 2 doses so far. And many people, because of lack of maybe the kind of time or otherwise, you may be wondering why I repeat remedies in some cases and why I give single dose in some cases. One of the reasons I only give single dose in many cases is when I find the vital force at a very, very low level, like I found in this lady's case. She had already lost a lot of blood and she was weak, so I gave her only 1 dose of Thalassi bursa pastoris, 200. The bleeding stopped. It from 2 cups in a day, it became 2 drops in a day. And when there was a recurrence after 4 or 5 days, I repeated 1 more dose. And she is doing fine, no problem, with 2 doses of Thalassi bursa pastoris. When the patient has much better vital force, and when the problem is chronic and has a very much better vital force, then I do not mind repeating even in high potencies multiple doses. So that is about Thalassi bursa pastoris, but I will take it up maybe in an independent webinar wherein we can discuss other remedies like Ustilago maidis, then Trillium pendulum, and another remedy like Helonius, all remedies which are very important in female gynecological problems. So, but for now, this was just a very important remedy which I wanted to end my seminar with. So I end my seminar with this. Thank you.
Thank you, Dr. Prashanth. Thank you so much. And honestly, the Thalassi bursa pastoris is very good remedy. In Allen keynotes, we can see these keynotes which we have mentioned just now are mentioned as it is. So we can see in the hemorrhage that this is the best remedy I have seen in my practice also. Thank you so much, sir, for explaining everything so nicely and so easily so that everyone here present, our attendees, can catch it.
Thank you. Bye.
Thank you, sir. Thank you, Dr. Prashanth, so much. And thank you all attendees for attending the webinar. Thank you all. Now we are going to end up the session.